You must have seen this instrument inside the OT. This is a electrosurgical generator. So there are three modes. One is monopolar and bipolar. Monopolar has coagulation mode and cutting mode. So blue is for coagulation and yellow is for cutting. So this is monopolar probe with yellow is for cutting mode and blue is for coagulation mode. There is a monopolar probe and there is another bipolar probe. Monopolar probe is single tip, bipolar probe is double tip. So this is the dispersive pad. Dispersive pad. This is usually called active electrode. Active electrode, and this is called a return electrode. What happens? From the generator, current goes through the active electrode. This is the active electrode and this is the tip. And the current, radio frequency current, AC current is concentrated at the tip. So it will produce the heat, and it will produce the heat which will cause the coagulation of the protein. And then current passes through the dispersive pad. This is the dispersive pad or return electrode to the machine again, and it completes the circuit. This is for bipolar. We will discuss it again later. Coming to the concept. The concept is, when there is a frequency or flow of radio frequency AC current of 300 to 500 kilohertz frequency, then there is production of heat. This heat will cause coagulation of proteins, or production of or vaporization of tissue. Vaporization of ICF, intracellular fluid. Coagulation of protein lead to formation of coagulum that will seal the vessels, and vaporization of ICF in the intracellular fluid, there will be production of steam. Steam production will be there. This steam will increase the pressure inside the cell, and it will lead to rupture of cell. That will lead to cutting mode, and the sealing of vessel is thus called coagulation of vessel. Okay. Next question is, why there is no shock, electric shock, because of this generator. In our domestic use at home, usually the current comes at a very low frequency, less than 100 kilohertz. It will activate the neuromuscular junction. It will stimulate the neuromuscular junction. So we usually get a current or electric shock at home, but the frequency of this generator is usually 300 to 500 kilohertz. Kilohertz means 500,000 hertz. That means frequency per second, cycles per second. So at this frequency, it will not stimulate the neuromuscular junction. At a very high frequency, it will not stimulate the neuromuscular junction, so there is no electric shock of this generator. If the electric generator machine is cheap or low cost, it comes around usually 8 to 10 lakhs. If it is low cost, it may give shock because they do not maintain at this frequency. Next is, there are three modes. One is pure cut, one is coagulation, and another is blend mode. See, in pure cut, there is a high frequency. So this is high frequency waves, multiple high frequency. The frequency is high, but it is low voltage, but high frequency current. It will produce cutting mode, that is 100% cutting. But in this is high voltage, the voltage is high. See the voltage, the baseline is high, voltage is high, and there is a less frequency, there is only two waves are there. So at high voltage and low frequency, we get the coagulation mode. Why? We will discuss. Another is blend mode. Blend mode is a mixture of cutting and coagulation. See, blend 1 is 50% on, 50% off. Blend 2 is 40% on, 60% off. And blend 3 is 25% on, 75% off. Depending upon our requirement, we have these settings. Next is, see. First is cutting. See, in cutting, I have told you it is high frequency and low voltage. So the wave is like this. This is high frequency and low voltage, and this is sinusoidal AC current. Okay, so there is a continuous. When the continuous current passes through into the tissues, continuous current passes into the tissues, it will production of steam, production of steam in the ICF. The ICF fluid will vaporize to produce steam. This steam will increase the pressure inside the tissue, inside the cell. Sorry. When the steam increase the pressure inside the cell ruptures. The cell ruptures and it will produce cutting. Cutting at a very high precision. High precise cut. Precise cut. So this is called cutting mode. The disadvantage is there is no coagulation, only cutting, and there is no smoke production. You have seen that. You must have seen in OT, during cutting mode there is no smoke production. This is an advantage of this. Okay. Next is coagulation mode. For coagulation mode, it has opposite. This is low frequency and high voltage. Low frequency means high voltage. This is one wave. This is another wave. This is a period of activation, and this period is called period of deactivation. Period of activation is there, period of deactivation. Electrode get activated, it passes, flows, gives an current flow, then it stops. Again there is a current flow, again it stops. Again there will be another current flow, and it stops. So what happens here? Because of this, one phase is active, another phase is reactive. During the active phase, current flows into the tissues or vessels. So there is some proteins inside our blood vessels, in plasma and tissues. So what will happen? The proteins get coagulated. Protein get coagulated. That will lead to formation of coagulum. During the deactivation phase, after cooling, the deactivation phase means it's a cooling phase. So the coagulum gets cooled and it produces a tight seal of the vessel. If there is no deactivation phase, the vessel won't be sealed. It will keep on producing, and there will be, at last there will be charring of the tissue. If we continue pressing the coag mode, then there will be charring of the vessel, charring of the tissue, that is blackening of the tissue, ultimately lead to again rebleeding. So And there is a activation mode, deactivation mode. During this deactivation mode, there is cooling of the phase, and that cooling helps to produce the seal. Next is blend mode. Blend mode, I have told you, the mixture. Blend is 80% cutting and 20% coagulation. That is mainly predominantly cutting. Blend 2 is 60-40, predominantly cutting and hemostasis. 40% will help in hemostasis. Blend 3 is 50-50, cutting with hemostasis. These mixtures and these combinations are also coming nowadays to help in our surgery. Next is coming to monopolar and bipolar. Monopolar. In monopolar cautery, there is a single probe. In bipolar, there are two probes. I have told you, from the generator, the current flows through this active electrode. This is active electrode to the body and to the desired tissue. Because the probe is very small, because of the small probe, small tip of the probe, the current get concentrated at a very small area. The concept is very small area. So when the current get concentrated at this very small area, that will lead to generation of heat because of the resistance, because of the generation of the heat, and that heat will cause the coagulation of protein. And again, that current will pass through the current has tendency to pass through the flow path of least resistance. So after that, from the body, the current will flow towards the point of least resistance, that is the dispersive pad. This is the dispersive pad, and that is called return electrode, again to the generator, and completes the circuit. So the coming next point is dispersive pad. The dispersive pad, usually previously it comes as metal. You have seen that in a metal pad, they will usually cover a normal saline cloth, cover it with a normal saline cloth, and put it under the thigh or calf. So the dispersive pad is of larger area. See, this the pad is now, the pad is coming as previously it was metal. There is a risk of more burn or distant burn risk is there. Now it is coming as a plastic or rubber pad, and this is also very flexible, so it can attach to the whole of the calf muscle or leg muscle, so that it will increase the surface area. So once there is increase in surface area, the current get dispersed, in the whole area, and that will lead to decreased risk of burning or decreased risk of burn in distant area. Previously, what happens, because of this metal pad, the metal pad will not apply to the whole of the foot or leg or calf or thigh. So there will be concentration of current at this suppose this is the leg of the patient, concentration of current at this part of the leg. So there is usually distant burn, unidentified distant burn, because of this monopolar. This is very dangerous injury. We have seen cases like this before. So unidentified injury after 2 to 3 days of surgery. So this is also medical legal. So patient might complain against you there is a burn, distant burn, because of the electrosurgical unit. So to prevent this, now we have rubber foldable materials that will completely attach. It will completely attach to the calf muscle. So it will stick like a glue. It will stick to the calf muscle. So there is increase in surface area, and that will decrease the risk of burn. Coming to bipolar. Bipolar has two tips. This is one tip and this is another tip. The tissue grasped in this part will be get coagulated. There is the disadvantage of bipolar is there is no cutting mode. There is no cutting mode. The tissue gets coagulated in between. So the current flows from the generator to the electrode and again to the tissue and again through the return electrode to the generator. So one is active electrode, another is return electrode. So there is no risk of distant injury. This is one advantage. So there is no distant injury because the tissue gets within the bipolar tissue get coagulated. So this is relatively safe, but the disadvantage is it will take more time. It will take more time. So more time means it will take more time for hemostasis, and so there will be risk of charring of tissue. So to prevent this, now you have some advanced bipolar devices. So see, this is the monopolar probe, single tip, and this is bipolar probe. This is yellow for cutting mode, and blue for coagulation mode, coag mode. Okay, so there is no in bipolar there is no yellow or blue switch. This is only for coagulation. Okay, this is the circuit I have explained about. This is the active cable, this is the return cable, and this is the return electrode, and this is a dispersive pad. Put the dispersive pad as close to the point of surgery. Okay. Next is, so we have advanced bipolar devices to prevent to manage. So in advanced bipolar devices we have three concepts. One is concept of fusion of thermofusion technique. Another is fusion of ultrasonic technique. So we have ultrasonic technique. In ultrasonic means we have using the sound waves or frequency for coagulation. That is harmonic scalpel. For thermofusion technique, we have ligature. I will explain each and every one by one. And there is a mixed. Mixed means there is thermal means thermal bipolar plus ultrasonic. That is called as thunderbeat. This is more advanced. Thunderbeat. That is ultrasonic plus thermal. Both are used in mixed. That is thunderbeat. Coming to the ultrasonic energy. In ultrasonic energy, we have this is called harmonic scalpel. You must have seen in this in OT. In harmonic scalpel, this is called active jaw, and this is called vibrating jaw. So the above one is called active jaw, the white. See this white pad, and this is called vibrating jaw. There is two jaw. Vibrating jaw. The vibrating jaw is fixed. This is fixed. It will keep on vibrating, but the active jaw is mobile. The active jaw helps to bring the tissue. So we'll suppose we'll ligate or cauterize or coagulate the round ligament. So we'll try to keep the round ligament in between and we'll press it. So the active jaw will bring it closer towards the vibrating jaw. So vibrating jaw is fixed and active jaw is mobile. Okay. The blade comes in contact with the tissue. The pressure causes coaptation of the blood vessel. The amino acids unwind and reshape. Hydrogen bonds are broken. Protein cells are denaturation of proteins. Same concept. The denatured proteins form a sticky coagulum that will lead to coagulation of the vessels. So, and there is also simultaneous cutting and coagulation. You have seen in OT, round ligament is coagulated first, then cutting. There are two modes. and there is the main concern, there is no temperature, rise in temperature. The main concern at a very low there is a rise in temperature, but at a very lower temperature than electrosurgery. So this is the audible feedback is there, and this is the switch. See, this one is called the active jaw or moving jaw. This is moving jaw. This is moving jaw. Moving jaw. And this is one is called vibrating jaw. This is vibrating. Vibrating jaw means this jaw keeps on vibrating to one fro motion, keeps on vibrating at a rate of around 55 kilohertz. That is 55,000 times per second. So at this vibration rate, it will generate heat. So that heat will cause coagulation of the tissues and cutting of the tissues. So there is a moving jaw and vibrating jaw. So this one is moving jaw and this is vibrating jaw. There is a machine. It is attached to a machine. See, in machine there are two figures. One is minimum, one is maximum. So two markings, maximum and minimum. The minimum point, we have to set. The maximum we have to set at 5. Minimum we have to set at 0 to 5. Lower, more the lower, more the coagulation. The minimum will help in coagulation. The minimum help in coagulation. More the lower, so it will usually set at 2 or 3, and maximum is 5. 5 means it vibrates at a rate of 55 kilohertz. So it will help in cutting. So in this, up to 5 mm vessels are usually coagulated, and the disadvantage is tissue stiffening. Because of this tissue stiffening, the instrument has to be used limited. The instrument use has been gets limited. The tissue gets sticked repeatedly gets sticked, and we have to change the instrument after 5 to 6 uses. Next is ligature. The concept of ligature is thermofusion. Concept is thermofusion, thermal energy. What thermal energy? Now there is a tissue response electrosurgical generator. That means it can generate current according to the response of the tissue with the help of microprocessor inside. So see, there is a jaw. We have to grasp the tissue in between this jaw, and from the tissue the machine gets a response. That is, the response is called impedance technology. Impedance means resistance. How much resistance the tissue is giving. The resistance technology, there is liquefaction. The current flows and there is a liquefaction of the elastin and collagen. Again, from the tissue, the instrument gets a response depend upon the resistance of the tissue. According to the resistance, the generated current goes into the tissue and will cause elastin liquefaction and collagen liquefaction and formation of coagulation. Important. There are 3 types of jaw. One is monopolar jaw, monopolar tip, another is bipolar tip. We can change that according to our requirement. And important is it cannot coagulate the small vessel. See, small vessel do not have elastin or collagen layers, so it can coagulate very small vessels. Next is NSIL. Third is NSIL. NSIL is temperature sensitive. There is a temperature sensitive nanopolar thermostat inside the machine, so that will give feedback. It can coagulate up to 1 to 7 mm vessels, and there is the advantage is there is no slipping because of the serrated surface of this jaw. Important point of the NSIL is it can bend. Up to 30 degrees 45 degree, 70 degree, 75 degree. Depending upon our requirement, the instrument can bend. So we can utilize in deep pelvic structures. So because of this bending nature. Next is Thunderbit. Thunderbit is the combination of bipolar and ultrasonic technology. So both modes are there. Bipolar mode is there and ultrasonic mode is there. So we do not need any two instruments. So sealing and cutting can be done up to 7 mm diameter with minimal thermal speed with only one instrument, Thunderbit. So I have told that harmonic scalpel up to 7 mm and ligature is up to 5 mm and Thunderbit is up to 7 mm. Coagulation can be done up to 7 mm. So remember this: harmonic scalpel up to 7 mm vessels, ligature up to 5 mm, and Thunderbit up to 7 mm. Also, NCL also 1 to 7 mm vessels can be coagulated. Disadvantage is it is very costly and cannot be used again. So two modes: one is sealing and cutting mode, this used by both bipolar and ultrasonic. So bipolar will cause sealing and ultrasonic will cause cutting. Ultrasonic mode causes cutting because of the vibration of the jaw, because of the frequency, increased frequency, high vibration. So it will cause heat generation, vaporization, and tissue rupture. So that is the concept of ultrasonic cutting. Sealing mode is only bipolar energy. So this is the Thunderbit. Both bipolar and ultrasonic mode is there. Next, important concept is lateral thermal spread of the devices. What do you mean by lateral thermal spread? When we coagulate and tissue, suppose we coagulate this tissue, this part of the tissue is coagulated, but the heat will also transfer. The heat is transferred to the surrounding tissues also. So that is called lateral thermal spread. The traditional monopolar can have 2 to 20 mm lateral thermal spread maximum. So monopolar can damage the adjacent tissues also. Bipolar up to 13 mm, traditional bipolar. But in NCL it is 1.1 mm, very less. It is less. And harmonic scalpel also up to 2 mm, Thunderbit also up to 2 mm, ligature is up to 2.8 mm. So remember, maximum lateral thermal spread is by monopolar, and minimum by NCL and harmonic scalpel. Okay. Next important is, there are very important questions in Viva of this complication of electrosurgery. There are few complications. First is defective insulation. Second is direct coupling or capacitive coupling. Then alternative site burn, mistaken target application, smoke generation, and lateral thermal spread. I have told you about lateral thermal spread. Maximum is because of monopolar, traditional monopolar. Minimum is by NCL or harmonic scalpel Next is coming to insulation failure. Sometimes after repeated use, there is break, minute break, very small break, that is not, the instrument is used repeatedly again and again because of the minute break in the instrument. So this is the electrocautery, monopolar cautery of laparoscopy, during laparoscopy. Okay, so this is the cautery probe, electrode tip, and suppose there is some minute breaks and that point comes in contact with bowel or bladder or any other tissue. So the current will flow from the path of the least resistance. So it will get current will flow to the bowel and it will get a perforation or burning or ultimately to perforation. So minute break leads to flow of current to the adjacent tissue like bowel, bladder, and other organs leading to injury, distant injury. So this is usually distant injury, and the main problem is it is usually unidentified during surgery. So Generally, these patients develop at day 3 or day 5 distension of abdomen. If there is a perforation of bowel, distension of abdomen, or leakage of urine, leaking of urine, urinary leakage at day 3, day 5, day 14, or ureteric injury. So distension of abdomen, leakage of urine, and there is complications. So operation is successful on the time of during surgery, but there are some unidentified surgery of this insulation failure. So you have to be careful about it. Next is direct coupling. What happens in direct coupling? See, this is the active electrode, this is the active electrode, and this is the trip. So sometimes we are doing surgery here, but this is the laparoscope camera probe. So sometimes during unintentionally there is accidental activation of electrode, which was in contact with another instrument, in contact with another instrument that lead to conduction of current or flow of current to the bowel, which was in, suppose the laparoscope or camera was in contact with the bowel, so which was in contact with the bowel or bladder or any other organ, so that will lead to distant site injury. Distant site injury, this is not directly because of electrode, but because of the secondary instrument. So because of the secondary instrument, the current passes to the secondary instrument which was in contact with the electrode. So if the bowel was touching this probe or instrument, then the bowel will get injured. So how to prevent it? Prevention. So anytime you are doing surgery or doing using electric monopolar or bipolar cautery, you have to do it under vision, and be careful that any organ or instrument is not touching your electrode, your instrument, electric instrument. So do it under vision, and any other instrument or organ is not in the vicinity, is not touching at a vicinity, is not touching your instrument. Next is important is capacitive coupling. What do you mean by capacitive coupling? This is during normal surgery. So this is the current passes through the electrode, and monopolar current goes to the desired tissue and causes coagulation. But sometimes there is production of current on the insulated outer surface of the probe, of the monopolar probe. That current usually get transferred into the metallic cannula. So suppose this is the metallic cannula. Through the metallic cannula, we are doing laparoscopy. This current passes through metallic cannula and transferred into the skin surface. So this is the skin of the patient, get usually transferred into skin surface, and there is no injury to the surrounding tissue. But if we are using and insulated non-conductive anchoring device, see, if you are using a non-conducting anchoring device or insulated device, what happens? The static current that is generated at the surface of the electrode, that do not get transferred to the skin surface. So that current will transfer if it is not also touching. If it is not touching also, so it will transfer to the vicinity adjacent bowels or any other organs. So it will cause injury to the distant organs without touching. So capacitive coupling means that organ is not touching your instrument, touching the instrument. So that can also cause coagulative or electric injury to the organ. The organ is not touching your instrument, but still the static current generated at the surface of the electrode will pass to the surrounding organ. That is because of the non-conductive cannula, plastic cannula. If you are using plastic cannula, so it is always advised to safe to use a conductor cannula, so the current can pass through it. See, this is the insulation defect. The current can injure the bowel, and this is direct coupling. The instrument is in contact with the electrode is contact with the another instrument. So which was in contact with the bowel. So the current passes from the to the secondary instrument and to the bowel. Next is, if in case of insulated anchor or cannula, so the current generated at the insulated surface will come to the bowel. So this is called capacitive coupling. Okay. Last is surgical smoke. During surgery, during coagulation, there is release of benzene, hydrogen cyanide, formaldehyde, bioaerosols, dead and live cellular metals, and viruses are produced during surgery. So that can also is a we inhale as a surgeon or assistant, we inhale that aerosols or viruses into our body. So that can also harm for our body. So to prevent this, we use some effective evacuation system to be used inside the OT. So these dangerous gases, harmful gases can be evacuated from the OT. This is all about electrosurgical unit. If any doubt, you can put in the comments, and next we'll study about laparoscopic instrument in the next video. Okay, thank you.